So, hi and welcome to everyone. I'm Dr. Harshitha Sridhar. I'm a consultant emergency medicine physician from one of the medical units in Bengaluru. Over to you.
Hello, everybody. I'm Dr. Priyanka. I work as a consultant in emergency medicine in Manipal Hospital, Old Airport Road, Bangalore. I thank Yashoda Hospital and SEMI for giving us this opportunity to discuss a little bit on research and clinical audit in relation to emergency medicine. Over to you, Harshitha.
So, Priyanka, now that this opportunity has come over and we had to discuss the session today, before we could start, I was actually recollecting the fact that in our latest had such an overwhelming response, isn't it? I think we had 100 oral presentation and 300 poster presentation that we had to deal with. And it was so good to see so many students starting to show interest in emergency medicine field and getting into research and audits. But you know something? Despite this, I still have some students who come over to me and say that there's still a lot of confusion and they want to understand further on what qualifies as a research and what makes it different from a clinical audit. Do you want to comment on that, Priyanka?
Absolutely. It's actually a very crucial distinction to make, especially early in one's training. So when someone comes into emergency medicine or any other clinical practice, more so for emergency medicine, because in emergency, we deal with both administration and clinical as one goes on. So it's like a mini hospital, which we are running in the emergency department. So both research and clinical audit at the end aim to improve the patient care, but their methods and their intentions are significantly different. And it's very important that residents know how to make the distinction very early from the beginning of their career in emergency medicine.
Yes, exactly. So let's start with research. As its core, research is about generating new knowledge. So it usually begins with a question or hypothesis. So the resident has to know that he has to create a question. Now let me give a research question. Is drug A more effective than drug B in reducing the time to pain relief and renal colic?
Yeah. So if you want to answer that, you start by setting up a structured study. So you can go about it by doing either a prospective or a retrospective study. That is, you decide what is the kind of study design you'd like to do. Would you like to observe what is already happening at your center? Or would you like to do an analysis or intervention, introduce a new drug which is not being used in your center and try to understand the outcomes? Or would you like to totally randomize it and do like an RCT? So it's very important to decide on the study design. Also, the study site. Would you like to do it only in your center? Or would you like to involve multiple centers and do it? Like, for example, Yashoda Hospital is a group of hospitals. So would you like to restrict to one unit of Yashoda Emergency? Or would you like to involve multiple? There are many hospitals who have branches like this. So accordingly, you can decide what kind of study site you want to choose. Also, it's important to have a timeline. Are you interested in doing the study over 6 months, 1 year? Then you formulate the topic, propose the research protocol, do the abstract, do a literature review on what you're going to study, get the appropriate approvals from the ethical and scientific committee, then figure out the data collection. Once you get the data, you do the analysis and interpretation, sit with your statistician, do the statistical analysis, results, discussion, and draw conclusions that could potentially change or guide future practice. So this is how you would go about doing a research study on any question which one is interested in doing.
So yes, as you rightly said, we are now starting to understand that in research, it's an elaborate process. You start with a research question and then you start finding your goal, your aim, and then you go through a methodology and then you come to a conclusion and with the result you come to a conclusion. Now, before we go further in depth of it, let's try to see what a clinical audit is so that we research questions. So because again, the students come down with questions which are more audit based and they do not understand what they're trying to raise is how to be differentiated with a research question. Now, I would say what a clinical audit is. So it's basically trying to check what we're already doing. Are we doing it right? It's about measuring the current practice against the standard established guidelines. So I have an example for the audience here. Are your triage times meeting the national benchmark or your standard SOPs or your benchmark of your hospital? Now, what do you think? Is this an audit question or a research question? So if the audience is here trying to hear us out, think over it. Are your triage times meeting your SOP guidelines or your standard benchmarks? So if this is already a standard practice that you already have one, you have a benchmark that's created by your organization. So you're just trying to audit it and see if your triage timelines are comes an audit question where you are trying to ask whether you're doing what is already being matched to what is being done. Whereas I'll give you another question. Does implementing a digital triage tool reduce the wait time better than the current practice system? So again, does implementing a digital triage tool reduce the wait time better than your current system? So here you're trying to bring in an innovation, you're trying to look into a new research area and seeing whether this new idea can actually make a difference. So you're trying to test an hypothesis. So this is a slight difference on how to start question and identify what comes as an audit topic and what comes as an hypothesis and a research topic. Priyanka, you want to comment?
Right. So, for example, an audit might look at how many patients. Now, suppose I give you an example which is more relatable. Like if you look at sepsis, any patient with sepsis receiving antibiotics, we'd like to go with surviving sepsis campaign guidelines, where you're going to give antibiotics within 1 hour. So this is already an established guideline. So I'm sure all emergency departments will have their sepsis guidelines set as 1 hour. Now, if you're looking or if you're checking for adherence to best practices, how would you go about auditing this? Here, you'll first measure your current practice. So first, you will try to understand or analyze and see what is happening in your department. So when you analyze and see, for example, if you do a study over, say, about 6 months, and you figure out that 65% of your patients are receiving antibiotics in 1 hour and 45% in 2 hours, that means you're not achieving your goal. So then your goal is set standard of 1 hour. So you see where you're standing. Now you reflect and see what are the causes of delay. Try to put practices where you can prevent or you can reduce the time of the delay. Then identify the problem, implement solutions to the problem. First, you see if you can practice the implementation. If you are able to do it in your department, then all the others working in your department will be able to follow suit too. So once you identify the problem and provide solutions, you give it some time for the solutions to act or for the interventions to act, say about a 3 months to 4 months lag period. And then you re-audit on the same thing. You set a new benchmark. Suppose your initial data showed 65% in 1 hour and 45% in 2 hours. Your new benchmark would be 80% in 1 hour and 20% in 1.5 hours. And then you collect fresh data to see whether you are reaching your new benchmark. And again, you repeat what you just did. You re-audit, you find the results, you compare with your previous result, you reflect your plan, you change and re-audit. Set standards and repeat. So audit is always a cycle. Audit is a teamwork, which you're going to do along with your team to look at your practices and see how you can improve your system of care.
Right. So I was actually wanting to ask with you, should a student start off with an audit in the beginning or should start off with a research? Like you said, it's a cyclical audit and it's already a structured guideline that has been there and he needs to look at it. But at the same time, we also realize that audit is a little more simpler process because there is a guideline and you need to just see if we are adhering to those guidelines. What's your comment on that, Priyanka? Should they start with an audit first or should they jump straight into a research?
I think they should do a research first. See, a research gives you individuality. It's something you are doing as a person with your peers and with your guide. So it's you and your guide who's doing it. Your friends and colleagues are helping you with data collection. Nothing more than that. And it's at the end of the day, it's your work. It's your study. It's your thesis. It's going to help you in the long run. It's something which you have read about. It's one topic which you've read about. An audit is more of a system process. It's more of a clinical pathway which you're trying to establish. It's about improving the quality, or it's about setting standards in your department. So I think for students who are entering into emergency medicine, probably towards the end of final year, or once they finish their theory, in between theory practicals, or after practicals, if they are waiting to finish their term of 3 years, at that period, they can probably think of doing something audit, because audit is more administrative. You need to be in the system. You need to understand the system to do an audit. So students who are getting into emergency medicine, I think it's a little too early to start getting into the audit process. Having said that, if you're already having a clinical audit running in your department, you can probably help with the data collection and see how things are going on. And that will in turn help you decide on your methodology for your research.
Yes.
I hope that answers you.
So I think I would also want to make that. Absolutely, Priyanka. Actually, even I wanted to make that point too. So you would be having clinical audits that are running in your department when you get into a new place. So it's good to probably talk to your mentors and see how you can help them out with data collection for that audit. And that would probably give you a little start, a kick start on how to go about these data collections and curiosity to challenge the current practices, see if you can test new interventions. You need to keep reading new journals, and this is how the research moves forward for you. So when I'm saying this, I hope I'm not sounding it very easy, or students might say that, are you saying that research is as easy as we are talking right now? How do you think the students have to go about figuring out a research question to them? Can you a little more elaborate? When I said curiosity is the only key, or is there anything more that they need to do?
See, if you're doing a study of something in your department, you need to figure out what is the sample you'll get, where you're working, what is your interest. So once you start seeing patients, what I always tell my residents, and what we usually follow, is we tell them to brainstorm. You have so much variety, so much diversity in emergency medicine. You first decide what line you want to choose a study on. Is it a medicine related topic, surgical topic, trauma related topic? Is it clinical based? Do you want to see a clinical profile or an observational study? Or you want to do something related to medicine, drug based, effect based? Or you want to do something related to equipment, ultrasound, any blood test? So if you decide on what line you want to do, then you can read up about it. If you want to do something about ECG and MI, ECG and heart failure, something about heart failure, then you look up what are the possible options. You want to look at clinical profile, you want to look at some medication which you want to introduce, or existing medication, or you want to compare some therapy in relation to heart failure. You want to look at outcomes. You want to look at, if you want to be more administrative, you can look at waiting times. You can look at maybe investigations. And you can decide based on that. You can speak to your peers. You can decide on how many samples you're going to get. Are you going to get enough to do adequate statistical analysis? Discuss with your statistician, do a literature review, and then refine your topic so that it becomes more adaptable, and also be open and receptive to feedback. Speak to your peers, speak to your mentors, and see what they have to say about the topic, and then go ahead with it. So always choose a topic which interests you. Don't be thrust upon a topic. So take about 1 or 2 months, or even maybe 3 months once you join emergency medicine, and see which part of it you like, which you'd like to research about for the next 2 years.
Yes, you're absolutely right. So brainstorming is something that is very essential to pick up a topic which builds that curiosity and interest. It's also very essential to check the feasibility of the topic, whether you can actually do that. Students come in thinking about a really nice idea, but you really don't have that study population in your institute. So it's important to check with your mentors and peers, as Priyanka said, that whether it's a feasible topic and whether you can have a specific topic, and be open to all these kind of feedbacks. So I've also noticed that students, when they come down, they are having a very unclear direction, and they try to attempt too much in that research question. They keep their objective, their aim very, very broad. So here I again recommend that try to aim for a fairly narrow focus. You want to go basically deep and investigate the topic in depth. You don't want to know 100 investigations, how they turn out in a disease condition. You probably want to go check specific on one or two, and then you want to see what difference does it make, things like that. So you should ensure that you have a clear, a sharp focus on your research, and you should be able to communicate that well in your dissertation or your thesis proposal. So when you take up a research question, you should be able to answer, who am I doing this on? For what am I doing this? Where is this going to land up? And when can I do this? How can I cover it? These kind of questions will help you get
I think Dr. Harshitha's voice, we're not able to hear her. So never mind. I think I'll take it from there. So the other thing we have found a lot of residents coming to us and asking is about whether clinical audits require ethical approval and regarding scientific committee approval and what exactly it is and how do we go about it. So usually clinical audits do not require ethical approval and ethical committee approval, but research requires ethical committee approval. So how do you go about it? So why is an ethical committee approval required? It is basically for confidentiality, data security, and patient well-being. Any study which is being conducted, it's a research question or a research proposal. So the ethical committee is basically an independent body which monitors research involving human beings and to ensure ethical conduct. So the primary goal of this is to protect the rights, safety, and well-being of participants while upholding scientific integrity. So usually every academic organization will have an internal ethical committee or a common one for a group. If your institute doesn't have an ethical committee, you can ask for ethical committee clearance from any committee which is within 50 kilometers radius of the trial site. So you can approach them, submit your proposal. Usually ethical committee meets will be held once in 6 months or once in 3 months. So based on their frequency and based on your urgency, you can decide on where you're going to do it and give an application for it and go about it. Scientific review committee, on the other hand, it provides an expert review of your research proposal, basically to ensure the scientific quality, also looks at ethical considerations and adherence to regulations. So it's very important for maintaining the integrity and safety for research. Also, the scientific committee does a risk assessment of trials. So these approvals are very important before starting the study. We also, we would also go about publication. It's very, very important that once you do a study, to go about considering publication. So how would you go about doing a publication once you've done your research? You identify a target journal. The journal should be a part of your field, that is any emergency medicine related journal. Look at its scope and aims. Consider the journal guidelines. Look at their instructions for formatting, submission, and the potential fees. Some journals require some fees to be paid for reviewing and publications. So go through that and see what is feasible. Then you prepare your manuscript. You rewrite your paper according to the guidelines of the journal, because all journals have some formatting requirements like citation style, format, font, margins, etc. So a covering letter will be required, abstract, any other required documents you can go through and get them ready. Then follow submission guidelines. Submit it. Usually most of the journals require an online submission. So you can go about submitting the article online. And then you'll have to wait. Usually most of the journals go through a peer review process. So once your paper is submitted and is accepted by the editorial team, they will pass on your paper to experts in your field who provide feedback and recommendation. So if there is any feedback and recommendation given, you will be required to follow the feedback and recommendation as advised by them. And then go about, the editor will make a final decision based on the peer review and your revisions. And accordingly, the acceptance, it gets accepted and it gets published in the subsequent journal. During the publishing process, you might require to be signing a publishing agreement. So once the publication happens, it's always advisable to share that your journal has been published so that more people read it. And the article, the journal also gets more viewership. So in this context, it adds on if you have a certification either from the ICMR's BCBR. ICMR, Indian Council of Medical Research, has a basic course in biomedical research, which is a free online course. So doing that course really helps with methodology and writing a paper and going about the thesis and publication. The same thing is also available as an international version called Good Clinical Practice Guidelines. It is not really free, but many institutes offer GCP guidelines and training. And in that, they in detail mention about research methodology and review processes, approvals, etc., which are required. So before proceeding with any research proposal or thesis, it's always recommended to get one of these two certifications. So you're kind of in line and you know what you're doing. Harshitha, would you like to add anything?
That's very essential what you mentioned, Priyanka. It's so true. I think it did sound very exhaustive, but it makes your life more easy when you go through certain specific medical research and you have the NMC or the giving you these free online courses. And as Dr. Priyanka mentioned, it's highly recommended that we go through these courses to make our life more easy to understand. Otherwise, the biomedical, the statistical part might sound Greek and Latin when you're looking at it for the first time. But when you go through these courses and when you read your own articles, with several other journal articles, you will be able to understand and analyze these statistical results that are coming through it. So, and publication also, I think, is very essential for our academic growth. It's good to publish, do publications, and this also helps us in our career growth and academic improvements. So, like coming back again to now that we realize that research requires an hypothesis topic statement that we need to create one. And then you also can go through these trainings. And now that you have brainstormed with your team and you're trying to narrow down and go more specific and focused, what you next want to create with the research question is to get an aim and get a goal. So aim is basically a broader goal which you're trying to go through these research questions. And the objectives would be on how you're going to achieve that goal. So when you want to prepare this, we would recommend something like a SMART idea. SMART idea is being more specific, aim and a goal objective that is more measurable, attainable, and it is realistic, and you have a timeline which you can manage. You do not want to talk about a disease condition which probably requires your end result to happen after 3 years of your training. So it's something that should be a time frame that can be defined, and you should be able to measure and attain these kind of results. So always remember that you want to make smart choices and you want to go through these specific, measurable, attainable, realistic and time period, time framed research aims and goals. So you need to align them all together. Now that the students are starting to understand this, let's see what is research and thesis? I think that's the next question, confusion that people have. Now that we've been just talking research.
So a thesis.
What is really the... Yes, Priyanka.
A thesis is usually a formal document. It's usually what is done to obtain an academic degree or a qualification. It gives you an in-depth analysis of a particular topic which is chosen. A research is more of a shorter document, which gives you a proposed research project. And usually you are giving the abstract, you are going to kind of outline what you're going to do it, and you're just going to collect the results and analyze them and go about it. Whereas in thesis, you need to be it's going to be more detailed. Whether it's a thesis or a research, the process is the same. You look at the research question, you outline the aims and objectives, you go about collecting the data, analyzing. So it's very important that we don't think about the results when we are analyzing, when we are collecting the data. We don't do a midstream analysis unless it's an interventional study or unless it's required by the study to do a mid-study analysis. Other than that, it's usually analysis is reserved to the end. If you start analyzing your data in between, then you can sometimes get deviated, or you can start collecting data in the second half of the study, which will bias your study and outcome. So the challenges which we have noticed, which students have with thesis writing, is managing time. They think it's such a big burden to do a thesis, and there's so much to write when it comes to literature review or writing results or discussion. And also they'll have their own academic tone, which they have to follow. And with the academic tone, the thesis, reading for emergency medicine, working in the department, as well as going ahead with the literature or a thesis, I think all these three should go in parallel. And you shouldn't think of one to be another's burden. Managing the time, managing your time effectively, and getting data from everybody else, trying to figure out a way where the burden of the data doesn't solely lie on you, and you find out a way where you can collect it from everyone and try to sort out the data in your free time. You have to set aside probably maybe 2 hours a week or 3 hours a week to, compile all the data collected during that week. If you leave everything towards the end of the thesis time, say your study period is 1 year, and you decide at the end of 12 months, I'm going to look at my data. If you want any correction or any additional information or something which is collected in the first month, it's going to be very difficult for you to look back and get that data. So the best thing is to look whether your data collection is complete on a regular basis. Say on a monthly basis, check whether all what you need for the study as outlined in your research protocol is available. And then,
Yes.
but analysis should happen only at the end. Another important thing is to avoid plagiarism. It's very, very easy to take somebody else's work and call it your own. But then where is your individuality? A thesis or remains with one for life, like your degree. It's your academic qualification. But you may do many research projects. You may be involved in many quality audits. But thesis is one which remains. For every degree which you take, you have one thesis which remains with you for life. So I don't think it is really right to just take somebody else's work and change names or institute names and say, this is my thesis. You should always go about doing something which is your own, and taking support from supervisors, peers, and utilizing your available resources are what are the most important things in going about thesis writing.
I absolutely agree to that. I think the students generally get those panics or the panics on how to go about writing such an exhaustive literature is only because their base or their starting is not appropriately understood. I repeat this again. You need to build curiosity in your academic training. Try to get those research questions. And if you get your aim and objectives right, then you're able to collect the right amount of data in your proforma. And then you keep collecting these data. And as Dr. Priyanka mentioned, you need to analyze not analyze, just get your data collected right every week so that you have your timeline set. So I here want to recommend to all the students or the residency program students here to say that you need to create a timeline for yourself. You want to know a set frame where you're going to talk about what's your interest, and that you're going to do a literature review. When you do a literature review, you're going to make note of all the articles and the books and the literature that you have gone through and make a note of it in a separate folder. Once you have that question and you brainstorm with your mentors, you bring down your aim and objective. Again, remember the guidelines that are recommended, the smart ways of doing things. And once you have a focused area, you create your proforma. Again, with a timeline, you're going to set, this is a time period, I'm going to fix this and I'm going to come through it. And once the proforma is ready and you are more specific on what you're going to calculate, it's easier to get those results analyzed at the end of the next time period where you're given for collecting the data. But Priyanka, I have another question. Many a times our students would be expecting another result, but it turns out that the results is in a way that they did not anticipate. They expected that the situation had to go in a way, the result had to turn out in a way. What do they have to do? They get stuck there. How do you want to recommend for that? Like the results are not coming the way they anticipated it to come.
See, most of the time, the results may not be, it may not be accurately what you want. So it might be somewhere close to it. If you're not able to get something which you have opted for, you give your reasons for it, you justify it. And you say that this is my study, this is my data, and this is what I found. And you can probably ask for some way to better it. You can probably ask for a comparative study with somebody else, or you can ask for more time that if I have to probably do it like a randomized control trial to prove whether it is statistically significant, or whether probably you need some more time in terms of you need some more sample, or you need a more duration of time to collect more data to see whether it really requires a change. Whatever is this research topic you set requires a change. So you can always give whatever justification you want in the form of recommendations towards the end of your study. The results, the conclusion of the study should answer the aim provided at the beginning of the study. So the aim is usually to analyze or to evaluate or to assess or to objectify. So most of these questions can be answered. It doesn't tell you that you're not going to do a study question saying, I want to do a study to show that I'm going to, all the sepsis patients in my department get antibiotic within 1 hour. That will not be a study topic. The study topic will usually be an open question. The research question will usually be open question to see what your practices are in your department amongst that particular group of patients. So whatever is the conclusion, it may not really adapt to what is available internationally or nationally, for which you should discuss with your peers and your supervisors and be able to justify that and give a reason on why it is different from everyone else.
How do we avoid bias, collection bias, reporting bias?
Bias should, yes.
Randomization is probably what we need to discuss. So your patient selection and going through randomization, certain amount of blindfolds, blinding in the sense you want to take some external person who is probably not aware of the anticipated result. So blinding them or randomization, I think, are also the key points that you would like to discuss with your mentors. That would also reduce some amount of bias, and it improves the quality of your research, the results. And if you want to look for publications, you also have to consider what are the anticipated bias, what can be, how can it be limited is also one thought that I recommend that you should look for. And then you should also be aware as to what limitations that you can have with your study. And it's good to comment on the limitations that you have. So when somebody else reads it and they want to, take your research question forward, and they have an opportunity to overcome that limitation, you can eventually see how a collaborated result can actually make a new change for tomorrow's new theory that might come out. Isn't it, Priyanka?
Yes, definitely. I couldn't agree more.
So to keep a nice, crisp conclusion, can I say that research is like cooking a dish? But now if you write a thesis, you need to write a recipe book on that dish. You need to take about what ingredients you've used, how you cooked it, what did you learn from it, and what is the outcome. So I hope the students here are able to relate the differences between how an audit is, what a research is, and when you have to write that, you write the entire detail as a thesis. So you should always keep asking yourself, am I trying to measure a practice or am I trying to answer a new question? So that will be your compass to start off with. And isn't emergency medicine a good enough field to get a lot of topics and questions for research? The last question that I have is are we short of these research questions, or the students find it difficult, or is it a subject where you have a lot of options to start off?
I think you have a lot of options to start off. You have the whole spectra from pediatrics to adult to geriatrics. You have from pre-hospital care to in-emergency care, and emergency translate to inpatient care. You can look at mortality, you can look at length of stay, you can look at length of stay in ER, you can look at timings. ER is all about timings, and it is so dynamic and so time critical. So you can either look at timings, you can look at patient profile, you can look at outcomes, you can look at medications, you can look at investigations, you can look at equipment, you can look at monitoring. There's so much you can look at. You can look at people, resources, administrative. topics, it's very, 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 very huge. So even
Yes.
a small research question can be very, it can lead to impactful changes, and you don't have to make it very complicated, and you don't need a randomized control trial in a thesis. You can just have it as simple as possible. And we need more studies in India, similar to the ones which is done abroad, and especially in pre-hospital care. And pre-hospital care evaluation and all cannot be done better than emergency medicine doctors. So I would not say that there is any dearth in emergency medicine in India. What do you think, Harshitha?
Absolutely, absolutely. It's such a dynamic field. So the reason I wanted to insist on this question is we do not want our younger peers to come down asking questions as to like, we don't know what to do. That question should not come in that way, because there's such a vast opportunity that we have with emergency medicine that there should be something or the other that should click a question for you, and you should try to make it better. And this is basically all that we're trying to goal is for better patient care tomorrow. So I think we should start small and stay very curious, and do not hesitate to seek help from our mentors. Isn't it, Priyanka?
Yes, definitely. So
I think, please go ahead.
I think that'll be all about research and clinical audit from us. And we'll be happy if there are any questions, then the Yashoda team can pass it on to us, and we'll be able to get back on a one-to-one basis. Harshitha?
Yep, I think we should call it the day here otherwise. So this is something I felt is more for an discussion and understanding, and just to motivate students. So there's much more scope and more discussions that can eventually happen. But I think for the evening today, Priyanka, shall we conclude this?
Yes, please.
So we thank Yashoda team and the Society for Emergency Medicine India for bringing us together today and having this discussion. Thank you.